possibly the end of medical co-pays, at least as we know them. Personal finance editor Jerry Willis going to give us some surprising changes to our employers' health insurance plans. You got to listen to this. And my exclusive interview with the former governor of Massachusetts, Mitt Romney. You know, he's speaking as candidly as I think I've heard him talk about the successes and the shortcomings of a state health initiative he helped implement. You're watching House Call. First up, though, the health care debate took on a new twist this week when we learned that the contested public option that we've been talking so much about could possibly be in again. Senate Democrats are considering a bill that allows states to opt out of a public option. Now, House Democrats unveiled a version of their own this week as well. It's important to point out that measure does not have an opt-out provision, but it would allow the government to negotiate directly with doctors and hospitals about how much money they get paid. Now, all of this means that both chambers must pass a single, unified measure before sending it to President Obama. Now, former Governor Mitt Romney, he's someone his name comes up a lot when talking about health care. 3 years ago, he focused on a lot of these same concerns that many Americans have when he was talking about Massachusetts. He talked about cost, he talked about spiraling access. Romney lost his bid for the presidency in 2008, as you know. I sat down with him this week for an exclusive interview to find out what he thinks President Obama should be doing to try and reform health care. Is there something about the Massachusetts model that you think Democrats, President Obama included, find just non-palatable, which is why they don't want to talk about it?
You know, I don't know what they find difficult here, except we have found that we can get everybody insured without breaking the bank and without a public option. There's no government insurance plan in our program here. We got 98% of Massachusetts citizens insured, and there was no need for a government plan.
Do you think that that's the issue, because there is no public option, that Democrats don't even want to talk about Massachusetts as being a model for the country?
It could well be. I think there are Democrats that are intent on jamming in a public option, even though the president himself has said that's not critical to the plan. We really don't need to have the government get in the insurance business any more than we say, you know what, we need to have the government make an automobile for us. Government does a better job than the private sector. That's baloney. Government does a terrible job, and the only reason people are insistent on the public option is because they so desperately want government to manage the entire healthcare system.
Are people, do you think, just misinformed? Is that why they have such high satisfaction ratings with Medicare and so much in favor of a public option? Do they not fully understand it? Or why is there that disconnect?
I think people don't fully appreciate how enormous the burden is that we're leaving the next generation with our entitlement benefits. I don't think they recognize that there are tens of trillions of dollars, and just how much money that is. I mean, the total economy of the United States is about 13 trillion. We're leaving a multiple of that as a debt for the next generation.
When you were first thinking about this, prior to 2006 when it got implemented, the two basic tenets were increased access and decreased costs. Which one of those was more important to you?
Well, when we were looking at solving the health care challenge here in Massachusetts, our focus was on getting people who were uninsured insured and stopping the practice of passing their costs on to the rest of the population. We really were unable to deal with and didn't have any pretense that we would somehow be able to change health care costs in Massachusetts.
Should the president be looking at Massachusetts as a model of lowering health care costs?
No, Massachusetts is not the model with regards to the second problem. Massachusetts is a model for getting everybody insured in a way that doesn't break the bank and that doesn't put the government into the driver's seat and allows people to own their own insurance policies and not to have to worry about losing coverage. That's what Massachusetts did.
I don't want to be one of those people who knocks the system in which I work and live.
However,
you know, I do hear these stories that are kind of heartbreaking, where you hear about people who used to work in the insurance industry who have come forward and said, we've denied things because we knew that it would be cheaper, frankly, for the person not to get care than for them to get care. And it gets back to this issue again, if there is a profit motive at all within a industry that is responsible for the care of others, can it really work at the end of the day? And the reason I bring it up again is that you see a lot of systems around the world that don't have that aren't perfect by any means. They have longer waiting lines, but that profit motive is gone. You don't have 47 million people without insurance. You don't have people turned away with preventable diseases. It's heartbreaking to see some of that stuff happen, and I just wonder still if the private insurance industry, the way that it is now, can solve some of these problems.
If people are concerned about the profit motive, there are places to go in this country, and I don't know what proportion, but it's got to be close to the majority, if not the majority, are not for profit. The profit motive is not the challenge in healthcare. And if you put the government in charge of healthcare, and now you're going to have government bureaucrats telling you what treatment you're going to get and what's going to be reimbursed, that's going to be a heck of a lot worse than having an insurance guy say, oh, no, you can't have that care. Because with the insurance guy, you can say, I'm going to stop buying insurance from you guys. That's how markets work. People are able to move. Single payer means I've got only one option. When it comes to my health care, I only got one place to go. And for most Americans, that's a frightening thing, and it should be.
Now, as far as Romney's plans for the future, as you might expect, he is not ruling anything out. He has a book coming out this spring, in fact, which many say serves as a template for what he might do as president if he decides to run again in 2012.